Welcome to Nurses Uncorked, where I pour out the unfiltered truth about healthcare life. I'm your host, Nurse Erica, serving up real talk straight from the front lines to your ears. Each episode, I'm uncorking conversations that matter to nurses everywhere, from the hilarious to the heartbreaking, the inspiring to the infuriating. No filters, just authentic nursing experience shared with a splash of humor and a dose of honesty. So grab your favorite beverage, put your feet up, I know they're tired, and join me as we uncork another episode of Healthcare Reality. Now let's get this shift started. Welcome to Nurses Uncorked, where I do the deep dives so you don't have to. I'm Nurse Erica, your trusted source for real talk, researched facts, and fearless advocacy in the nursing world. Let's uncork the truth. My guest this week is Dr. Julie Siemers, and we are going to be tackling all of the recent controversy around the NCLEX, new grads, nursing programs, all of it. I want to thank everyone for downloading this episode. Don't forget to leave a review, rate, and share the episode with friends. Patrons of the podcast get early access to episodes, patron-only bonus episodes, Zoom parties for as little as $5 a month. There's a link in the show notes. But first, let's do a cocktail. And this week, we are having a vodka cran with Red Bull. I already mixed it up. Here's the ingredients. Red Bull, I've got sugar-free cranberry juice and my vodka. This is a classic. Everybody loves a vodka cran, right? And I just added in the Red Bull. You want about 1.5 to 2 ounces of vodka, 2 to 3 ounces of cranberry juice. You stir that together over ice. And then you add 3 to 5 ounces of Red Bull. You pour it over and lightly stir. You can garnish with a lime or orange slice. And you can also adjust the ratios of the ingredients if you want to taste. Welcome back to another episode of Nurses Uncorked. We have big questions today. Have nursing schools made it easier to become a nurse? Is the new next-gen NCLEX easier to pass? Are new grad nurses no longer competent? These are the questions we're going to get into. My guest today is Dr. Julie Siemers, an expert in nursing education. I reached out to her after a recent viral video that she posted about this very subject. And now I know that this is going to be a little bit controversial for some people. And I'm going to ask you guys to take in the information. This is not an attack on new grad nurses in any way, shape, or form. But the fact is that experienced nurses all over the place have been kind of raising the alarm, and we can no longer ignore the data because, yes, there is data to support this. It's a question of patient safety, and I want everyone to really focus on that. But let me introduce my lovely guest today. Dr. Julie Siemers has devoted her 45-year career to revolutionizing patient safety in healthcare. As a nurse, educator, and author of Surviving Your Hospital Stay, she has become a trusted voice for patients and their families. Her impactful TEDx talk, How Not to Die in the Hospital, highlights her commitment to addressing the critical gaps in patient safety. Recognizing the need for stronger nursing education, Dr. Siemers founded LifeBeat Solutions, a transformative training program that equips nurses with essential clinical judgment tools, communication skills to advocate for patients, and systems that embed safety as a daily practice, not just a policy. Driven by her mission to combat the healthcare crisis of preventable harm, Dr. Siemers empowers patients, families, and healthcare professionals alike. She is a passionate advocate for patient safety, working tirelessly to transform nurse education and improve outcomes, one course, one hospital, and one voice at a time. Through her work, she inspires a culture of vigilance, advocacy, and prevention in healthcare. Welcome, Dr. Siemers. Welcome to Nurses Uncorked.
Thank you. I really appreciate you having me on your show to talk about this really important topic. So thank you.
Yeah, it's such an important topic, and I'll be honest, it's one that I have kind of danced around for a while because people get very up in their feels about this topic. They tend to kind of take it as a little bit of a personal affront if they are a newer nurse. And that's really not what this is about. But it's something that we need to bring to the forefront and talk about because, like I said, it really is about patient safety. So, you posted a viral video recently, and in it, you said that the NCLEX national pass rate just dropped to an all time low, almost 72%. And this should terrify you. And you said that in 2023, the NCSBN, the National Councils, the State Boards of Nursing, revised the NCLEX to the next gen as we know it to try to measure clinical judgment and critical thinking. And then the first year out, pass rates went up pretty dramatically, leading people to believe that they may have made the NCLEX easier. And you agree. So, can you please tell us all about that?
Yes, it is something. I've been in nursing education for the last 16 years, and it really has transitioned from when I started in 2009 to today. I see, as you said, a lot of different factors contributing to what's going on with our nursing education. And obviously, we all know COVID was a big player in that, so we can talk about that as well. But yeah, I've seen, and speaking of that post, that video, I've gotten several thousand comments, some of them from nurses, some of them from other educators, some from just regular lay people, and some from students. And so we've got all sorts of input into what the issues and what the problem is out there. And it really is ones that, yeah, I think is accurate.
Yeah, and it's a bit shocking and a little bit frightening when you think of the potential outcome of what that implies. I guess the big $1 million question is, are these current new grad nurses safe? What do you think?
The research will tell us no. There's three studies that were done in 2006, 2016, and 2021 measuring new grads that had passed the NCLEX. And it was a 5-hour exam. So part of it was written, part of it was application based, like in a simulation scenario. The numbers were huge. They were great studies. It was over 5,000 participants in each one of them, 26 different states, and 141 different schools. In 2006, they found that only 35% of these nurses out there in
I
their first
have
year.
that study in front
Yeah.
of me. I was gonna say that one. So yeah,
Yeah.
tell us about that.
Only 35% of these nurses out there with licenses starting in practice were safe, competent, and practice ready. Then in 2016, a decade later, it dropped to only 23% of those nurses were safe, competent, and practice ready. And then in 2021, it fell to shocking 9%. So the data's there. And then we
Yeah.
have nursing leaders and hospitals saying, my gosh, these new grads can't even put two data points together to critically think or use clinical judgment to know when a patient needs escalation of care, et cetera.
Right. Well, they're partially to blame, the employers. But on the flip side, it's a reasonable expectation to expect inexperienced new grad nurses to at least accurately recognize patients' clinical data and the primary problem that they're being treated for, right? And
Right.
when a nurse is unable to do that, the patient probably is not going to have their care safely managed, right? So that's the ultimate concern. My good friend, Matt Garvey, he coined a term and he needs to write a book about this, but he named it the phenomenon of diminishing experience.
Mm,
And it talks about, isn't that such a great term? Like you already know, right, what that means. But, COVID created the perfect storm of inadequate nursing graduates and in the pandemic nursing education system, both pre and post graduation. So they're not getting the education they deserve in nursing school. And then they're not getting it as a new grad. They're not getting proper preceptorships. We've gone from the novice to expert model to the novice to just slightly less novice model. It's the blind leading the blind, right? Experienced nurses running from the bedside.
yeah.
You've got new grads put in charge, new grads precepting other new grads, but they lack the critical thinking that comes along with the real world experience. What do you
Yeah,
think?
exactly. You're 100% right. I think the average time of a nurse right now is about 3 years. I mean, I remember when I was getting into ICU training, my preceptors had like 15 years
Me too.
plus
Yeah.
lots of training, prior to even getting at the bedside. And nowadays, you just don't have that. I know there's a lot of hospitals that have their ICU programs online, which I think is a big problem in
Yeah.
itself. But yeah, they just don't have the knowledge base or the experience to teach what the nurses need to that critical thinking and clinical judgment. How do you put those thoughts together when you've got all this knowledge thrown at you in school and you really haven't learned how to apply it? So that's the biggest problem. And if they don't learn to apply it, they probably never will because they're out
Yeah.
there just chasing their tails doing tasks all day.
They're set up for failure before
Yeah.
they even get started. I say it's not really their fault. However, I have also said that, okay, yeah, 2021, 2022, whatever, you're having video game nursing school, you were set up for failure. It's not your fault. But at what point do you then go back and fill in the gaps? At what point are you responsible for recognizing that you have some gaps that need to be addressed and being proactive, taking the initiative to, get the education or experience that you need because it comes down to patient lives and your
Yeah.
license.
And I think it is a game of what they don't know what they don't know, meaning they think they've got the adequate skills to safely
Yeah.
take care of a patient. When I was doing my MSN and then my DNP and my topic was failure to rescue, I was so surprised. I'd already been a nurse for 30 years and I'd never heard the term. And my educators I was working with, because I was doing presentations as part of my program, and they're like, oh, yeah, this is really important, but it's not in our nursing curriculum either. And so,
Yeah.
one of the points in the research that I found surprising, but not really, is that those physiological observations or physiological changes happen 6 to 24 hours before an unplanned cardiac arrest. So that's the problem when nurses don't know what they're looking for and how to string together the data to say, and this is how I explain it to students, this is your continuum of your patient. Here's a healthy patient, which we don't have any of those. On
Right.
the other end of the spectrum is the patient's dead. Our job as nurses is to find where on the continuum that patient is every hour that we're taking care of them, or more frequent if they're critical. And they don't have the skill set to be able to do that. How do I know if my patient's, sliding down the scale towards critical? For example, if a patient is in atrial fibrillation, if the nurse doesn't ask the question, is it chronic or is this a new onset? That can be a huge problem because they won't know then to ask the next questions or appropriate monitoring. Or if a patient's got hyperkalemia, okay, what do they remember from school? Peak T waves, right? But
Mhm.
that doesn't tell you where on the continuum your patient is clinically. But if we can reinforce those critical elements, such as they're having multifocal PVCs or their QT interval is lengthening, that is where you pick up the phone in a panic and call the doctor with that data to say, we're going to crash here soon. And they don't see it. And that's why these unplanned cardiac arrests are happening so frequently in the hospitals.
And they don't have the experienced nurses as the resource there that they can go to and say, "What should I be looking for? Should I call the doctor?" Because those nurses took their decades of experience and ran during COVID. Yeah. Are schools lowering admission criteria? Are they lowering the requirement for passing grades? What's going on in nursing schools around the country now? And I know it's a generalization, not every program is the same, but what are you seeing?
I've worked at 5 different schools in 16 years. And what I've only worked in the private industry for profit. So I don't know what they're doing in the nonprofit or the the state funded schools. But I do know that there was a lot of let's look at admission criteria and make it a little bit lower the bar a little bit because we can catch them up to speed when they get into our program, so to speak. The other issue is there are accredited schools out there that students can take online classes to get their prereqs done, such
Mm.
as anatomy and physiology, pathophysiology. We had students at the school I worked at in California that were coming in with credits that they earned in 3 days. Anatomy and physiology in 3 days. And then the faculty are saying, why do we have to
No.
reteach, in adult health when we're talking about perfusion? These students are clueless. Well, because they raced through and potentially cheated to get their prereqs done. So that's an example.
And we'll get into the cheating. Oh my God, 3
Yeah.
days. I can't imagine. Those are some of the hardest classes that you take. There's oh,
Well, yes, and it's the foundation of your nursing
yes,
knowledge, right?
absolutely. Yeah. So when did they kind of start doing that, lowering the criteria? Was it during COVID?
Yes, but a lot of adjustments, I believe, that were made during COVID never went back to baseline or what I call normal
Yes.
because we're still screaming for nurses. And as you mentioned, because they're not staying at the bedside, we have nurses going out of BSN schools straight into nurse practitioner schools without any experience. I did a post on that too, because that's a big deal. They're figuring out how to use their knowledge or their education, but they're not going to the bedside. We're still trying to catch up, and we won't at this with all these issues, we're not going to catch up. It's going to be
Yeah.
a gap continually.
How could they be so nearsighted during COVID to think, okay, we understand there's a desperate need for nurses. We need to get some out there. We can lower our criteria. But how could they be so nearsighted to think we're going to catch them post graduation during a pandemic? Who's teaching them?
Yeah, that's a really big problem. And I think that's probably the narrow vision, the myopic of healthcare in general. I know we're not talking about the broad healthcare, but I think that's been a problem throughout all of our little siloed fires that really add up together to make the healthcare crisis where we are today, right?
It makes sense, and it's a little bit validating because I have to tell you a personal example. My daughter's best friend just graduated from a BSN program, and this entire time it was an accelerated program. The entire time she's been in it and after graduating, she has said, "It's so easy. It's not that bad." And I have been scratching my head, beating my head against the wall going, "What is going on?" Said no nurse ever.
Right.
No nurse ever has said it's so easy. And I mean, she's reasonably intelligent, but nothing crazy. How do you go from nursing school was the most traumatic, difficult, challenging thing I've ever done in my entire life? 99% of nurses will say that, right?
Yep.
To it's so easy. What is going on?
The only thing I could think of is that, and I've seen this before with faculty that I've worked with, they want the students to be successful. And so they'll help them and assist them. So, for example, they may give a test blueprint. Here's what you need to study.
Oh,
And some of them will go into a little more detail than they should. So we call that teaching to the test. And if the instructor's going to do that, then yeah, it would be pretty easy instead of figuring out what are the important concepts that we just covered this week on gastrointestinal issues or whatever, right?
I can't imagine ever being given any kind of template as to what's going to be on the test. I felt as though they picked the most obscure thing that was written under one diagram in the required reading that no one ever touched on. And that was the test question, right? There was
Yeah.
no hand holding, none.
And I guess this speaks to the variance in schools around the country. You may be on a lot of the comments on that TikTok video was there's no way we had to pass with this and here's the
Yeah.
bar, it was really high and then you've got others that said, my faculty were reading off PowerPoints and taught me nothing. So I think there's a big disparity or discrepancy in education, which is scary too. If they can pass the NCLEX with a crummy education or a great education, is that really measuring readiness for practice?
I did have one or two nursing professors that I think were not great educators that did read off of a prepared PowerPoint and interject almost nothing. But we had to fill in those gaps then ourselves and we had to learn it because they were not going to tell us what was on the test at all. It just defies explanation to me. So what I'm hearing, what I've been hearing for a long time from educators around the country is that they are not allowed to fail students. What? How? I speechless, no words. How can this be going on?
I have heard that as well from different schools. If you think about the for profit schools, attrition hits the bottom line of the university, especially if they're not getting any federal funding like state schools do, right? And so they're totally driven, all of their revenue is tuition based. And so if they fail a student out, then that's one less student paying tuition. And I just think again, it's so short-sighted that they can't see. I don't know, maybe they're thinking the student will pick up the knowledge as they go through the program, or I don't know what the rationale is other than the bottom line and the revenue of schools to keep their doors open. They need tuition.
That is absolutely criminal, in my
I
opinion.
agree.
If ever there was an area of study where they should not hesitate to fail students that are not meeting the expectation, it should be healthcare, right?
One of the talks was failing to fail, and what she was talking about in this talk was the clinical, and I think that's another really big issue because to me that's where the rubber hits the road. If you don't have an
Mhm.
instructor asking you Socratic questioning as a student to say, okay, this patient just got admitted with CHF. What is your priority? What are you concerned about? What are you going to be vigilant? What are you going to be surveilling on this patient? If they're not doing that and they're just administering medications and changing a dressing and doing skills rather than thinking, students will never learn that.
Yeah. What is the answer? Do you have advice for educators out there that feel powerless, that understand how dangerous this is and don't want to pass students that they feel shouldn't pass, but they're being forced to?
So there should be in every curriculum, the criteria to meet the exam, to meet the clinical day. If the student doesn't come in on time, if they forget their stethoscope, any of those kinds of things, the school really needs to determine what is it that we're looking for and hold everyone accountable. And I think with doing that, you started the ball on the right foot to say, we've got consistency. Here's our expectations. For example, I was teaching a class a couple years ago and I had students coming in at 5 after the hour, 15 after the hour, 20. I'm like, this is ridiculous.
Would have been sent home.
It's very disruptive. So we as a team decided this if the students are more than 5 minutes late, they can't come in till break, at the 50 of the hour is what we did. And a lot of the students were like, well, traffic's bad and all these excuses. I'm like, hey, this is the expectations to teach you how to be a professional because when you start work, who you're going to be relieving that wants to go home doesn't care about traffic. They just want you there on time so they can give handoff report and go back to their families.
Yeah. It's so difficult because sometimes I hesitate to have these conversations because it's, well, in my day, and I just feel like I'm aging myself, and I think there's some things that we really need to move forward on. Like, can we please stop having ridiculous rules around not allowing nursing students to have a tattoo or a piercing or unnatural colored hair? I think some of that stuff is just archaic. We could get past that. But when you're talking about you don't even bring a stethoscope to clinical, yeah, no, you need to go home. Go buy one or something. Maybe I'll let you come back in after lunch, but that's insane.
Yeah.
Every semester we had students fail, every single semester. And now it seems like it's unheard of. I don't know.
It's scary. It
It
truly is
is.
scary.
It
I
is.
think what we talked about in those studies, and this whole conversation started because of NCLEX pass rates lowering this year. My concern is when students pass the NCLEX and they're out there practicing and still aren't safe. And the nursing leadership in a hospital may not even know that.
I agree.
That's what scares me more than anything. They did earn a license and now what?
And they have a false sense of security because technically they're deemed competent. Technically, they've met all of the criteria, and they passed. They got their 85 questions or whatever, and they passed, and they think it wasn't that bad. I must be good to go. And then other nurses are looking at them going, and this is another area that's hard too because the whole nurses eating their young and the bullying conversation, don't want to promote that, but sometimes I think it's hard for them to separate the two. They think, oh, here it is, that they're bullying me, when some of the time it may actually be that they are recognizing that, oh my god, you don't know what you need to know.
Yeah, you've got some serious gaps here
Yeah.
being able to critically think. Yeah.
Yeah. So, is the emphasis more, do you think, on teaching more and more content in nursing education curriculum instead of focusing on applying the knowledge?
No, not more content. There's way too much. There's a quote out there by one nurse educator that says, "We need to be teaching the need to know, not the nice to know." And
Okay,
so I
I
think
agree.
part problem in some schools is the content is too much. The students get out of school, they'll memorize what they need to do to pass the exam, but I don't believe we're really teaching them how to think and how to use the data and the information and the concepts. If they don't have a clear understanding of perfusion, that concept, then they're going to totally miss the boat on what's going on with the patient because they can't string the data together to make that call to say, we're in trouble here. It's not just nurses either. I mean, this story that I tell on my TEDx talk of Lewis Blackman, and a lot of educators are familiar with his story because it was on the CUSIN website. But when Lewis was critically ill, the resident said to Lewis's mother, when she asked the question, why are his lips so pale and why are his feet cold? And the classic definition of shock, the resident wasn't putting that into application to the patient. It's right in front of his eyes. So when he said, well, that's what happens when blood flow is diverted to the major organs. Well, yes. And so is a heart rate of 147 that was at midnight with this poor boy, and they couldn't get a blood pressure the next morning. That's what was missing. Again, that failure to rescue piece of why is a 15-year-old that's healthy, other than the surgery he went through, why does he have a heart rate of 123 the day before? It just wasn't adding up, but nobody was taking these signs and saying, we got a problem here.
Yeah, I every step of the way, I just keep going back to my education during school and then as a new grad, even after my preceptorship. My preceptor continued to precept me unofficially, right? For a long time. And every step of the way was, why do you think you're doing that? It was never, what's the answer? It was, what's the answer and why? Now, why do you think, really forcing you to think through every single thing. And I don't think that's being done. As a nurse, my stethoscope has always been one of my most important tools. But honestly, there's been so many times that I've wondered, did I really hear that murmur or was it just background noise? That changed when I started using the Echo Health digital stethoscope. It's wireless. It connects straight to the Echo app, and suddenly I could hear and see heart sounds because it shows you the actual rhythm. Echo combines the stethoscope you already know with enhanced audio and advanced AI to help you detect heart and lung conditions earlier and with more confidence. Echo's digital stethoscope amplifies heart and lung sounds up to 40 times, and the noise cancellation cuts out all the distractions. Unlock murmur and AFib detection powered by Echo AI along with digital recordings that integrate seamlessly so your team can hear the same thing that you heard, backed by millions of heart sounds and 8 FDA clearances for devices and AI algorithms. Clinical studies show that those who use Echo are 2 times more likely to detect heart disease. This isn't the stethoscope you learned with in nursing school. It's the stethoscope built for the future of healthcare. Smarter, clearer, and more connected. Upgrade your practice today with the Echo Health stethoscope and experience the way listening should sound. I trust Echo so much that I've been working with their team to create a special offer just for Nurses Uncorked listeners. Right now, you can get up to $50 off plus a free customizable chest piece cover at echohealth.com/uncorked. Your purchase may be HSA and FSA eligible and may even qualify for CME reimbursement. Plus, Echo guarantees you'll detect heart and lung conditions more confidently. And if you don't, you can return it for a full refund. Go to echohealth.com/uncorked for up to $50 off plus a free chest piece cover. That's ekohealth.com/uncorked. There's a link in the show notes. What do you think is going to happen with the NCLEX? Do you think they're going to have to? I know they just unveiled it. It's only been, 2 years, the next gen, but do you think they're going to have to go back and reassess?
That's a hard one because they're supposed to every 3 years. It was 2013, 2016, 2019, and then they delayed because they were trying to add the clinical judgment piece and all these
The irony.
style. Yeah, exactly. All these alternate style questions, but changing in 2023, changing from you need to get every single part of a select all that apply question correct to get the question correct to partial credit. Why?
Yeah.
I don't understand that. Yeah.
Yeah. How do you feel about there are, I think, quite a lot of nursing programs around the country that will withhold new grads their ATT, their authorization to test, until they score high enough on whatever that school's version of the exit exam is, the exit HESI or whatever they're requiring. So basically, you have someone that has met the criteria, they have graduated, they've earned the credit, they've passed the classes, but they're not scoring high enough in the school's opinion on this exit exam. That's supposed to be predictive of passing the NCLEX, and so they won't give them this golden ticket to go take the NCLEX. What do you think about that?
Yeah, that is called a lot of state boards will not allow that because they call it high stakes testing.
Okay.
So, where I see what schools need to do is move back the bar. Let's do first year if it's an accelerated program, second year, and really have those bars earlier in the program because a student shouldn't be able to make it all the way to the end of the program and then the schools say, you don't know enough. Why didn't we assess that along the way? And I think exams are not the best way to assess application of knowledge. It may be the best to say, do you know normal potassium levels or whatever? But it's not enough to say, do you know what to do when you have a hypo or hyperkalemic patient? What are you going to watch for? So that application of knowledge is huge. And I think it's the missing piece in nursing schools of being able to assess this student ready to go on and build on their foundation. Is their foundation strong enough with these concepts, oxygenation and ventilation? Not understanding the difference. Just for example, if your patient's on a PCA pump, but the nurse pops their head in the door and says, oh, I see his O2 sats are 96, 97%. We're fine. I don't need to go in and count his respirations. And then the next time we go in to visit, we're like, oh, whoops, he's dead, because seeing the difference of O2 sats and
Right.
CO2 buildup if they're not on a capnography monitor
Mhm.
and we're not counting respiratory rate, that's a big oops, right?
So, how would you, in a perfect world where you're given carte blanche and there's all the funding, how would you revamp nursing education?
In 2016, we got together as faculty and said, we can't leave the heavy hitting or heavy lifting to the end of the program. We need to figure out what these students know. And so we did. We put this together. We had them come through after their first adult health, med surge class, and they were petrified. But I have to tell you, and we only had 25 points out of all of their course points that applied to this, but it could have failed them or not, right? But I had students come back to me later and say, thank you for doing that. We were the best prepared students in that new grad program. The
Okay.
other ones didn't know what they were doing with IV fluids and with, for example, one of our scenarios was a gunshot wound. And in this scenario was a dressing with green on it, an elevated temperature, and an elevated white count. And this faculty, were not looking forward to doing this because they thought it was a lot of extra work for them
Mhm.
until they saw that the students weren't able to put those three pieces of information together and say, I got to call the doctor. And then they were all in.
Yeah. All right. Let's talk about cheating
Ugh,
in nursing. This is a big issue now, and I know I sent you one of those videos, and I'm sure you get inundated with them all the time. People send them to me, all these crazy accounts on social media that we'll take your HESI, your T's for you, but then we'll take all your nursing exams for you somehow, some way, and the NCLEX, and we'll write your papers, and oh my god, it just seems to be everywhere.
yeah,
What are you
it's rampant.
seeing and hearing?
So 3 hours ago, our anatomy teacher, one of the students taking a comprehensive exam because it's end of the term today or this week, said, there's a student over there sitting by me and I can hear something. So the faculty went over and she had a headband on, ears, and he said,
No.
take that off. And her earbuds fell out.
Oh,
So proxy, into her computer, and then they were telling her which answers to select. And the faculty member said, I can't believe this because last exam she got 100.
Yeah, yeah, I bet she did.
Yeah. So that's one way is proxy exams, like you were mentioning. There's other students that have Ray-Ban glasses on that have
Yeah,
recording
the
in there.
smart glasses now. Oh my god, those are crazy. Yeah.
Yeah. Um, so we just have to stay a step ahead, but unfortunately we're not, it's just rampant. I mean, they sell exams, they proxy in to take exams for them. So we've got to be, okay, now how do we fix that one? So now they have to use the campus computers to take their exam so they can't proxy in. Uh, yeah, it's crazy. When I was the dean, whenever I had an academic integrity, sent my way, I would sit that student down and I'd say, "All right, let me give you an example. Let's just say you're a mom and you have a 7-year-old and your daughter has asthma. Her rescue inhaler isn't working and you're really concerned about her. And now you're going to the ER and they're giving her the treatments and they want to keep her because she's not very stable. You get admitted to the PICU and you just have this telepathic sense that the nurse coming through the door cheated his way through school. Are you going to let that nurse touch your daughter? Would you leave their bedside? Would you even know what to look for and to watch for?" And they were like, "Oh,
Yeah.
you have to make it real for him."
Well, and how is that not automatic dismissal from a program?
Yeah, it should be. It goes in the conduct committee and looks at all
Yeah.
the evidence but yeah, it should be.
So cheating has always been around. It just seems to be that it's getting more sophisticated now. And I think we kind of relied on, okay, well, they won't pass the NCLEX then, even if we somehow get them through the program, they won't pass. But if we're making the NCLEX easier and they are passing, and then I read something recently about having NCLEX exams be taken remotely from home instead of in a testing center.
I heard that too. I heard that was a consideration, and I'm like, "Hey."
Why? I know that there's some places that it's remote and it's cumbersome, they have to travel, but, like, okay, it's a rite of passage. You do it the one time, hopefully. You can do it. You can get the hotel room, you can travel the 200 miles if you happen to be one of those that are not living, and it's not the end of the world, because the greater good is making sure that you're not cheating.
Yes, and that is the only test that has not been compromised that I know of. So if ATI and all these other testing platforms have been compromised and have to change their exams, then that should be a big red flag to the NCSBN to say, why would we consider doing that? Because all bets are off if that happens.
Yeah.
That's scary.
Are they doing that in other fields that you're aware of? I mean, my son just took the bar exam. He graduated law school, just took the bar. And the things that they had to go through, and it's in person in a testing center, but it's, the registering your computer 3 days ahead of time. And then they still make them do a Scantron in this day, like all these crazy things. I can't imagine someone getting to sit on their couch at home and take the NCLEX.
Yes. And, me passing with 85 questions isn't a thorough exam for me. And yes, I understand it's computer adaptive. I do get that. But you can have some wild questions in there that they're not supposed to be, but questions that really aren't going to pertain to the majority of the patients that you'll be taking care of. I just don't know if like we've been talking about here, that it's a very good ruler or metric to see are they safe and ready for practice.
Yeah. Well, did you know that this is off topic, but in Australia, and I'm sure in some other countries, they don't require any kind of an NCLEX type exam to measure competency? I
I
talked about
didn't.
this on a recent episode of the podcast. Yeah, their thought is you've passed the program. It's rigorous. You've been tested throughout, and so you're competent. Go out and be.
Wow.
And when I've spoken to nurses from Australia about it, they think it's crazy that we have to do this. We're all appalled. Like, what do you mean you don't have to prove your competency? And they're like, well, we did. We did prove our competency. We're good. We're good. We were tested. It's different. It's funny, isn't it?
It is. And I wonder, what are their patient safety rates? Because I know ours compares to the UK compares to Canada, in the statistics that I talked about in my book of 250,000 patients dying of preventable harm every year. And I think that's low because so much of it's not reported or death certificates aren't appropriately marked in the
Mhm.
Redonda case. I mean, that
Right?
put
Yep,
natural causes. I mean,
they
come on.
sure did.
Yeah. So I just don't think we have accurate data. But what I think is the boards, and I think there are some countries, and maybe you know this, that do this, is there's a hands on piece that
Yes.
they have to do.
I mean, I had to when I took my CNA board exam certification, that was hands on in addition to a written component for just being a CNA. I had to demonstrate, taking the manual BP and the transfer techniques and all the things. Why are we not doing some basic skills in a testing, component for new grad? I don't get it.
I would love to see, and it's probably a manpower issue. I would
Yeah.
love to see the critical thinking, clinical judgment scenarios. If they can't safely care for X amount, let's give them 3 scenarios or whatever. So there's some variety there. If they can't do that, they go back for remediation training.
Yeah, I think that would be great. People would lose their mind.
Right.
Can you imagine that being announced? But
Yeah.
honestly, we've got to do something drastic at this point. It's bad
We do.
out there.
Yeah, I think the pendulum has swung so far. It's almost like, where do we find center and right now? And I know that a lot of nurses are leaving the profession because they don't feel supported. They don't know what they're doing. The workload is insane, which perpetuates, it costs so much money to replace a nurse. And it's just this, we're in a vicious cycle.
We are. We are. And okay, so here's the outcome of everything that we're talking about that I wanted to ask your opinion of. There seems to be a generation of nurses now, and I'm generalizing, it's not just new grads, but there seems to be an uptick in I can't even like make myself say it. Nurses not assessing their patients. This to
So
me is the most appalling thing
it
that a
is.
nurse can do. The most.
Absolutely. And I will go into my seniors classroom every single time I give them this lecture on failure to rescue. It's interactive, so I guess I shouldn't call it a lecture. And I will ask them, so in all these clinicals you guys have been in, how many of you actually see the nurse that you're working with do an assessment, like what you learned? Breath sounds, pupils, neurological, checking their skin, pulses, pedal pulses. Probably only 20% of them raise their hand. And they say they ask every now and the nurse will say, I don't have time. And I reiterate the point to the students that is your baseline. If you don't take a listen to their lungs and a couple hours later they're in respiratory distress, that you could have head off at the pass because you could have called and said, Hey, Dr. Jones, they've got crackles halfway up. We need to do something, before they get critical and need to be moved to the ICU. So, yes, that is the most horrifying. I agree with you 100%.
It
How can you operate as
enrages
a
me.
nurse? Yeah. How can you just jump straight into let's go pass meds for these patients?
Yeah,
It's
and I'm hearing that all the time from new grads also saying that the nurse that they're following is not doing it. Now, I worked with one nurse for 9 years, close to a decade, who I never once saw use the stethoscope, and it drove me insane. And now I know that she didn't because occasionally she would have one on, rarely, but where I was, there was semi-private rooms. So there were many, many times that I'd have bed A, she'd have bed B, or vice versa. We would be in there first thing in the morning when you would be doing your assessment. And I saw firsthand that she never assessed ever. And it was no coincidence that that same nurse was also the one that had 3 sentinel events over the years. I just,
yeah, they take shortcuts and they believe that an assessment isn't that necessary. Why should I have to check their pupils? Why should I have to check their pulses? But you're 100% right. One case I wrote about was a guy who had a knee replacement and kept complaining of increased pain, more than just surgical, it turns out. And the nurse calls the resident at 2 o'clock in the morning and said his foot is cooler and the pulses are decreased. And the resident said it's been that way since before surgery, which he was wrong, but the nurse didn't follow up.
And she didn't
And
have a baseline to compare it to.
exactly, did not reassess by the time the patient ended up with compartment syndrome and lost the leg. It surprised me, Erica, because on that TikTok post, one nurse wrote in and said, well, she did her job. She called the doctor. And I go, where
Oh,
did you miss patient advocacy in every single state nurse practice act? It is your job, no matter what the doctor says, to do the right thing for that patient and should have escalated. Number one, should have reassessed. But yeah, it's scary.
it's terrifying. And honestly, once you get comfortable with physical assessments, they're quick. They're quick. You
Yes.
can do a pretty thorough head to toe pretty quickly once you become competent. And there's just no excuse. And, I'm the first one to talk about safety and ratios, and I know they're giving you impossible assignments. I know. But there is just no excuse for not assessing your patient, even if you can't do it because you're getting pulled away the first time you're in the room. If you have to do it at 9, 10 o'clock, 11 o'clock, what? But at some point, you're going to go back and assess your patient because there's no excuse not to. But they're not
Yeah.
doing it.
Yeah. And that's where this copy paste and the EHRs is happening. That's really
Yes.
super scary. It's just,
Well,
I
and they're
remember,
they're fraudulently
yeah.
documenting these things that they're not doing. And what they don't understand is when we talk about nurses being criminally prosecuted, unfortunately, in the last few years, 99% of the time, it's because of fraudulent documentation. That's where they get them. And there's cameras everywhere. They can see you weren't in the room at that time, never did assess this, and yet that's falsifying documentation. That's often a federal offense. This
Yeah.
is how nurses are going to prison, and they don't think anything of it.
I think this is a perfect example of what we teach in nursing school. We give, at least in the schools I've been at, there have been one, at least, maybe two health assessment classes a semester, right? Or a session. And I think, all right, we're teaching them again how to use a tuning fork. Number one, who cares? I've never used one. We teach them to do the whisper test.
Yeah, I kind of
Well,
forgot
a
about the tuning
reflex
fork.
hammer, right? A reflex hammer. I'm like, come on, seriously? The only where you're going to use that is NOB on a mag drip, right? To see if they've
Yeah,
got jars. But again, if we're not teaching them how to do, like you just said, an assessment in under 5 minutes, and that's a long time. If
yeah.
we're not teaching them to do that efficiently, then you're right. They are going to skip it because they think it has to be this 20 or 30-minute thing that they had to learn in school and do the 500 checkpoints, right? Yeah.
Yeah. Oh my gosh. It's maddening to me. And I don't know what the answer is. I'm almost wait, this sounds terrible, but I'm almost waiting for that inevitable case to go to court for a nurse to be criminally charged and get a terrible sentence. And, I'm against the criminal prosecution of nurses, but I think it's almost going to take that to see a nurse handcuffed, thrown in prison for a few years because they simply documented an assessment that they never did. I think it's almost going to take something like that to wake other nurses up.
Yeah, I tell my students when I was working in the ICU and we had paper charts back then, I would go assess my patient. I come out to the nurse's station and chart. And there was two of them that stands out as just like, you've got to be kidding me. One, they charted dorsalis pedis, the DP pulses 2 plus bilaterally. This patient was an amputee.
I was waiting for it. I knew you were going to say that.
Yeah, I'm back. They had done that charting for 2 days. They just copied each other. The other one was pupils, too reactive, brisk, whatever. And the patient had a glass eye.
Oh, God.
And it made me think, if I can't trust the nurse before me that's going to do an accurate assessment, I can't really trust anything about him or her. And that's
Correct.
frightening.
Yeah, 100%. Yeah. Do you have any advice for the nurses that are out there seeing this happen, knowing that they're working alongside someone that they know is unsafe, whether it's because they didn't get the education they deserved or never had a preceptorship or whatever, that's sitting down and charting that assessment at 8 o'clock because they never actually went and assessed all their patients? Do you have any
Yeah,
advice?
it's interesting. I just finished a course on psychological safety, and I think that is a huge what culture we have in a hospital environment, whether it's even the unit specific or the whole hospital. To me, is leadership. Meaning, why would we put up with an environment where we can't speak up because that's really dangerous, and people don't feel safe, whether it's the whatever team member. And so I think being able to speak up and feeling safe to doing it and doing it in the way that, hey, I think we need to reassess as a team how we're doing something, how we're communicating. People need to feel safe to do that. And if they don't, they never will. So I think as leaders in healthcare, that's one of the top priorities that I would do is to say, hey, we're all a team here together. Nobody's perfect. And I know that patient harm occurs, I would say 99.9% of the time because of systems errors and
Yeah,
not the individual. But
I
when a
agree.
culture, when a facility, an organization will point fingers to the doctor or the nurse, then that really destroys confidence that, hey, I got your back. Yes, you are a human and humans make mistakes, but we've got to find a way for that just culture to be a real thing and not just what's talked about.
Not just a catchphrase that's
Yeah.
being tossed around and not actually practiced anywhere, it seems, anymore. Yeah, I agree.
But I think your nursing license, shoot, I would even go to the board of nursing if your manager or the CNO won't hear you, then take your concerns, further up. It's just
Yeah.
like the patient care. We've got to escalate to the charge nurse, to the house supervisor, to the chief of staff, maybe, or the administrator on call, to say, we got a problem here and we need to fix it before there's a huge problem. But I think that's one of the biggest problems in healthcare is lack of transparency.
100%. Absolutely.
Now for your enema of the week.
This week's Enema Award is brought to you by Happy Bum Co., a leader in at home enema solutions. Let's talk about something we don't usually talk about: gut health. We all know it impacts everything: our energy, our mood, even our skin and immune system. But when your digestion feels sluggish, bloated, or just off, it can throw your whole body out of balance. That's where Happy Bum Co. comes in. They've created easy, safe, and yes, even stylish, I said stylish, at home enema kits that will help you naturally support your gut health. No chemicals, no awkward pharmacy trips, no complicated setups. Just a clean, effective way to reset your body and get things moving again. And here's what I love most: Happy Bum Co. takes away the stigma. They make gut care approachable, empowering, even a little bit fun, dare I say. Because let's be honest, if you're not feeling good on the inside, it shows up everywhere on the outside. I've seen firsthand how much better people feel after finally taking charge of their digestion and gut health. Lighter, clearer, more energized, and more themselves. And with Happy Bum Co., it's something you can do in the comfort of your own home on your own terms. So if you're curious or just ready to feel better from the inside out, check out happybumco.com. That's happybumco.com and use promo code NURSESUNCORKED for 15% off your first bundle. There's a link in the show notes. The Enema Award this week goes to Hackensack Meridian Health, Jersey Shore University Medical Center in New Jersey, where the nurses are in the middle of contract negotiations between the hospital and with their union, HPAE. And allegedly, the hospital is offering them only a 1% wage increase. And I'm told that that may even be actually just merit or performance based, which means that if you're not meeting that invisible threshold, you may not even get the piddly little 1%. Well, at a recent bargaining session, the union turned in hundreds of unsafe staffing forms, laid them out on the desk in front of the attorney for the hospital and management. And allegedly, the attorney said, "We don't appreciate these theatrics, and you just killed a bunch of trees," which is absolutely appalling. Mind you, the CEO allegedly makes over $7 million a year. And the nurses, they just voted overwhelmingly to go on strike. There's no strike date yet. They're hoping that the hospital does the right thing, but how often do hospitals do the right thing for nurses? You may have heard me talk about this in a recent video, but what I didn't mention in the video is that they're also pushing for safer working conditions, in addition to a petition for metal detectors at every entrance and a security officer in the ED. There was also a recent incident, allegedly right after a bargaining session, in which management claimed that there's no security safety issues at all. Like, everything's fine here, nothing to see. And then hours later, a housekeeper was cleaning a stretcher and a loaded gun fell out onto their foot. There's pictures of it online. Unbelievable. You cannot make this stuff up. In any case, I received a really lovely email from one of my followers, and they brought me up to date on everything that's going on there at Jersey Shore University Medical Center, and they asked me to talk about it. Well, as soon as I posted a video, the floodgates opened, and so many nurses there have reached out to me. They're really so appreciative that I'm highlighting this, and I will continue to highlight this. But yeah, this week's Enema Award goes allegedly to Hackensack Meridian Health, Jersey Shore University Medical Center in New Jersey. Thank you so much, Dr. Siemers, for sharing all of your wisdom and insight with us. Tell everybody where they can find you and your book and that viral video, all the good stuff.
Yes, my website and then all my socials are drjuliesiemers.com or at TikTok or Instagram or whatever. My courses are on my website. They're locked because they're paid courses, but just go on there and see if there's anything of interest. I post a lot of articles on LinkedIn. I put them on the website as blogs. Again, just trying to inform, to educate, and empower both nurses and patients and their families. I really believe that's one thing that we can do together. Communication breakdowns is responsible, per the Joint Commission, for up to 70% of patient harm events.
Yeah. I mean,
And if
it's a national patient safety goal, right? Like,
yes,
every time.
yes.
Yeah.
And if we can bridge that gap as healthcare providers, and this is what I talk about on my TEDx talk, as healthcare providers, we need to listen. And as patients and families, you need to learn to speak up. And hopefully we'll be in an environment that the nurse says, oh, your mom's 70 and she's confused, but this isn't her normal. Then let's figure out what's going on. Is it oxygen? Is it blood sugar? Is it electrolytes? Any of those kinds
UTI.
of things. Yeah. To work together.
I will link all of your links in the episode description for your book and TEDx talk and your social media and all the good stuff for
Thank you.
everybody.
I appreciate
Yeah.
it. The one thing I'm working on, really, I'm really excited about is developing an app for patients and their families to have as a resource.
Okay.
And then I'm going to add the nursing part of it, which would be, content from the courses, which again was focused on the concepts. So, yeah, that should be coming.
I want to thank everyone for downloading this episode. Don't forget to rate, review, and share with friends. Patrons of this podcast get early access to episodes, patron-only bonus episodes, Zoom parties, and lots of other perks for as little as $5 a month. There's a link in the show notes.